Hi everyone, my name is Jane Palmer. I'm the Director of Quality, Patient Safety and Patient Experience here at IWK Health. World Patient Safety Day was established in 2019 by the World Health Organization. It's a day to be recognized annually on September the 17th. The adoption of a resolution called Global Action on Patient Safety. This day is firmly grounded in the fundamental principle of medicine, first do no harm. The theme selected for World Patient Safety Day 2021 is Safe Maternal and Newborn Care. This is due to the significant burden of risks and harm women and newborns are exposed to when receiving unsafe care during childbirth. Despite the significant progress made in reducing global maternal and neonatal mortality, targets are still far from being achieved. Even before the COVID-19 pandemic, approximately 810 women and 6,700 newborns died daily, with the causes occurring mainly around the time of childbirth. About 2 million babies were also stillborn every year, with over 40% occurring during labor. Most of these deaths and stillbirths are avoidable through the provision of safe and quality care by skilled healthcare professionals working in supportive environments. In the following video, you will hear from our leaders and colleagues in the Women's and Newborn Health Program who are tirelessly dedicated and committed to keeping our moms and newborns safe every day. I hope you enjoy this short vignette that highlights what this team is doing every day to keep our patients safe.
Good day, my name is Darlene Inglis and I'm the Director of the Women's and Newborn Health Program here at IWK Health. Together with my physician co-lead, Dr. Jim Bentley, we provide leadership, direction, and support to the Women's and Newborn Health Program. It's my pleasure to announce and promote World Patient Safety Day 2021. It's important for us to be active participants in the global action on patient safety. When speaking about patient safety, we must emphasize the importance of remaining firmly grounded in the fundamental principle of medicine, first do no harm. The overall objectives of this Patient Safety Day are to enhance global understanding of patient safety, increase public engagement in healthcare safety, and promote global action and prevent and reduce avoidable harm in healthcare. As a Women's and Newborn Health Program, it's important to highlight that maternity care is affected by issues of gender equity and violence. Especially important to note that birthing persons' experiences during childbirth have the potential to either empower or to inflict damage and emotional trauma. Therefore, I stress the importance of this year's campaign slogan, Act Now for Safe and Respectful Childbirth.
The World Health Organization has created World Patient Safety Day to highlight all aspects of safe care and recognize everyone's role in providing the safest care, from patients and their families to healthcare providers and leaders. We're all in this together, and that's become even more prevalent during this pandemic. While physical safety is extremely important, patient safety is not just physical. There's emotional safety and cultural safety, protecting a patient's privacy and ensuring they're informed about their care and respected in the choices that they make.
My name is Cynthia Mann. I am the manager of the birth unit and the family newborn care unit here at the IWK Health Center. One of the things the staff here in the birth unit are very excited about is we have really learned over the past year and a half, 2 years with our experience of the pandemic and COVID, we've actually gotten to look at different ways to provide education. So even that interprofessional education, we've done more online work, we've done more work across the country even, and working with healthcare providers across the country, across the globe, to hear about how they're providing care to birthing families, how they do fetal health surveillance in particular. We also are looking at, how did they change their care models during COVID and trying to learn from others so we can still keep, our family-centered care model at the forefront, but also how do we keep people safe in a whole different context. I think one of the things that has been a priority for the advocate for a while now is actually what's called safety coaching. So we've had a number of staff that really want to take that course that teaches error prevention methods, that teaches us how do we make sure that we feel confident to speak up when we see things that might impact safety, how we speak up when we want to improve a person's experience, or again, make sure they get the best care possible.
Hi, I'm Jody Simpson. I'm one of the registered nurses on the IWK Obstetrical Life Flight team. I've been in this role since 2017, and part of what we do is taking a critical care team from obstetrics and taking them to hospitals throughout the Maritimes, specifically PEI in Nova Scotia, and bringing those women and their babies back to the IWK for a specialized level of care. One of the biggest things that I pride myself in is making sure that my patients are safe in transport, explaining to them what it's going to be like to be in the air, whether they've flown before or not, when you're in a helicopter, when you're in an airplane, or even if you're in a ground ambulance. They're often by themselves, and part of my role is to make sure that they feel safe and that they know that we'll be getting back to the IWK where we'll reunite them with their family.
Here at IWK Health, we work together to make sure all care providers are communicating respectfully, together, and with the patient and family, ensuring they are the focus. We have multidisciplinary rounds to discuss best practice, town halls to share project ideas and success stories, and learning opportunities on topics such as trauma-informed care. IWK Health recognizes the impact that safe care has on everyone in the community and how care transcends generations.
Healthcare must be highly reliable, but it's also complex. Outcomes can be compromised even for the most well-intended, well-educated team. In an attempt to move away from a name, shame, and blame culture, the IWK launched an interprofessional fetal health surveillance quality improvement rounds. These quality improvement rounds provide a safe space for the interprofessional maternity care team to review events involving fetal health surveillance together. Shared learning is really powerful.
Hi there. My name's Heather Scott, and I'm the head of obstetrics at the IWK Health Center in Halifax and at Dalhousie University. And I'm here with Emily.
Hi, I'm Emily Gray. I'm a third-year resident in obstetrics and gynecology here at the IWK through Dalhousie University. Fetal health surveillance is a key component of providing safe obstetrical care, as it is how we assess fetal well-being in pregnancy and during labor.
We are very fortunate here at the IWK to have a diverse group of healthcare professionals who are involved in providing obstetrical care for women here at the IWK. And that includes nursing, anesthesia, obstetrics, and of course obstetrical residents, family medicine, and midwifery. Each and every one of these professionals plays an important role in providing optimal, patient-centered care, and each brings a unique perspective and priority. The challenge is in bringing these priorities together and making collaboration decisions that ultimately improve the care that we can provide for women and their newborns.
Interprofessional fetal health surveillance quality improvement rounds provide an opportunity for our diverse team members to collaborate and share their perspective. They provide us the opportunity to review national fetal health surveillance guidelines to ensure consistency in the care we provide. They also provide a space for members of the obstetrical team to review more complicated clinical situations and obtain valuable feedback from members of the care team in a safe environment.
Obstetrics is a team-based discipline, which requires the trust and communication as well as collaboration between care providers and the family. Through our fetal health surveillance educational rounds, we've been able to promote a lot of this communication and collaboration that carries us through to the birth unit where we continue to provide care for women and their children.
Fetal health surveillance is vital to maternal and newborn health. Effectively communicating fetal well-being between team members is essential. The way we communicate as a team impacts those receiving care. The language we use when communicating fetal well-being is crucial. It needs to be consistent and it needs to be practiced.
As we close today, I ask that we all remember one of the most important aspects of safe, excellent, quality care is active listening to patients and their families, which conveys respect for their self-knowledge and builds a trusting relationship. It's only through shared knowledge, transmitted in both directions, that care providers, patients, and their families can co-create an authentic, viable, safe, and respectful plan of care.